Now. So thank you to everybody for joining us. My name's Michelle Wilson. I'm the CEO of Maluk Timor Australia, and I'm just organising the first part of our webinar today. Today will be very interesting. We've got Gordon, Jeremy and Madalena giving us all another perspective on the work that's happened in East Timor this year. Before they start, let me give you a little bit of background on them. So most of you know Dr. Jeremy. So he's our CEO in Timor-Leste, and you know that he has been up in Timor for about 5 years with his wife and children, and he's got lots of stories and insights and challenges about the challenges and the joys of working in Timor-Leste. Gordon, in 2007, Gordon went to Timor-Leste for 4 weeks and managed to stay there for 4 years. And he loved it so much, he liked it so much, and he also says it changed his life. He met his Australian wife there, he was married there, and his eldest son carries the name Murak, I think I've said that right, which means a previous priceless treasure. His book of memoirs about the country is entitled Beloved Land, Stories, Struggles and Secrets from Timor-Leste, and was winner of the 2014 ACT Book of the Year and People's Choice Award. He is a visitor at the School of Regulation and Global Governance at the Australian National University. And our third speaker is Madalena. She's one of our team leaders in our HIV program. She's a nurse. Hello, Madalena. She's a nurse and is now a certified HIV trainer. So I'm now going to mute myself, turn myself off, and hand over to Gordon.
Thank you, Michelle, and good afternoon to everyone from Canberra. I want to begin by acknowledging that I'm speaking on the land of the Ngunnawal people, and I'd like to pay my respects to their elders past, present, and emerging. And I was flattered and delighted to be given the opportunity to participate in this webinar. I think Maluk Timor is a wonderful organization. I think it's an organization that does a lot of what I believe is really important in development, which is really unshowy, important work. And I think this is a really good opportunity for Maluk to both thank its supporters. No organization would be able to work as it does without its supporters, some of whom are on the call today, but also really to give us a flavor of the work that's going on this year. I mean, this year has turned out like no other. And I know that there's plans to be had for the year, but it's really good to hear from Jeremy and from Madalena their perspectives. Let me talk a little bit about myself, and then I'm going to give Jeremy a sort of checkup questions. We're going to speak for about 30 minutes, and then we're going to sort of throw out the conversation for wider discussion. So as Michelle said, I came to Timor in 2007. And I came for 4 weeks. I ended up staying for 4 years, and there's many times I wish I was still there. And I was reflecting just in the minutes before we began to speak about what the Timor of 2007 was like. I remember I flew in from Darwin. I think many of us had taken that flight. You'd leave really early in the morning. And I remember when we arrived in Dili, it looked like the whole city was covered in snow. There was white everywhere on what looked like the rooftops, between the foliage. And of course, it wasn't snow. It was the tarpaulins that were provided by the United Nations and the International Organization for Migration for the 150,000 Timorese that fled their homes in the 2006 crisis. And my work there originally was to work with people who were working for, who'd been veterans during the Liberation War. And my job was to try to figure out what they'd been doing for the 5 years since independence. And as Michelle said, I mean, I almost liked the place from the get-go. It reminded me of a Gabriel Garcia Marquez novel in lots of respects, but it also chimed in with some of the memories that I had as a child of being talked about. The Santa Cruz massacre in 1991, I have vivid recollections of a priest telling us to pray for Timor-Leste. And also some work that I'd done as a young man working for Amnesty International, and we had some expatriate Timorese coming over. And I find myself, I did a little bit of work for this research project. I ended up working for the United Nations. I ended up working for the Australian Federal Police. My accent will tell you I'm not from Australia originally, but I ended up working for the Australian Federal Police as one of their advisors in Timor. And I found it just an endlessly kind of fascinating time to be there, as I think it's a country that really touched me, as I think it probably has everyone on this call. And what was most fascinating about it was, at a professional level, was to see this kind of country being built up in front of my eyes. It felt like I was on an aircraft that was being sort of built in midair, and it was just an endlessly fascinating time. Personally, as Michelle said, it really changed my life. I met my Australian wife there. We got married there. And if any have been to Dili, we got married in that the church at Tasitolo that just overlooks, that's in the shadow of the giant statue of John Paul. And I often say, I'm very happy I met Suzanne, but I've often said if I hadn't met her, I'm sure I'd still be there, because it's a place that endlessly fascinates me. And when we came back to Australia, we had our first child. He has a Timorese name, as Michelle said. His name was Charles Murak. Murak means a precious, priceless treasure, one that you cannot swap, which is a word that's in kind of in a sort of word that's really used a lot in adat and in kind of ritual exchanges in Timor. And that's sort of what we feel about him most of the time. I mean, he has his moments like everyone else. But I also wanted to truly, I have a background in academia, and I wanted to really try to write down my experiences of living in Timor. And I wrote a book of that experience. I kind of sat down and wrote it really quickly, and to try to make sense of this sort of place where the past was not yet past, where hope and history was rhyming, where there was a giant international presence that was going through. And it's sort of written as a book of memoir. And it's I think I had a look at it a couple of weeks ago. I mean, it's 7 years old now. It feels a little bit dated, but it's something that I'm still proud of, and I think something that's really important to try to write our way about the experiences. I'm still connected with Timor, not as much as I'd like to be. I think every year, except this year, I've been in Dili in some shape or form. And at the present, I'm trying to finish a book of Teton English idioms that I'm working on with a man called Anacleto Ribeiro, who I think is one of the participants on this call. And that, I think, underscores for me something that comes up across from some of Jeremy's writing, which is the importance of death and sort of rituals that happen in Timor. It's really striking when you look at this dictionary, just how many phrases are to do with sickness, how many phrases are to do with death, how many phrases are to do with kind of birth and life. And so I think I'll forever still be connected with the country in a way that I imagine you'll be, Jeremy. So what we wanted to do was just sort of have a little bit of a conversation about this. And I knew of Maluk Timor's name it was kind of in the recesses of my sort of mind. I think I maybe saw it mentioned on the ATAN website, but I only really came to know of the organization through Jeremy's blog, in which he writes really vividly, evocatively, truthfully about his experiences, good and bad, in Dili. And I think I wrote Jeremy a message and I said, I really enjoyed sort of reading the blog, because it's difficult to write. It's difficult, especially to write about a country that you live in. It's difficult to write about a country that you love, because you're not really sure. And I find this with a book that I wrote, that what I write is not necessarily what people read. People read it in different ways. So I wanted to sort of begin this conversation, Jeremy, just by sort of asking you about, how you approach your writing. What were you trying to exorcise or exercise with your writing, and how does it sort of talk about Timor as it is today?
Yeah, thanks, Gordon. sorry to intrude. There's one or two that maybe just need to be muted. We're just getting a little bit of noise through the feed. Yeah, look, I didn't really start out as a writer, Gordon. This was really a lazy way of trying to keep my friends and family updated, more like a, travel diary. I wasn't a Facebook person, so I thought, well, I'll just, stick it on this blog and people who are interested can follow or not. But then, it wasn't long after being here that all these fairly absurd and bizarre things start happening to you as a foreigner here. You feel incredibly out of place. And it was one of those things where I was like, oh, I've got to tell somebody this story because it's just, outrageous. Whether that was, I remember one of my first months here, I had my iPhone stolen, and I, was trying to do the Find My iPhone thing, and ended up getting the police involved. And this thing evolved into this huge story and this comical police raid on a village where I led virtually a SWAT team up to this little village. And I'm walking around with my laptop like a water diviner, trying to follow this signal, which is sort of jumping from place to place, and seemed to be leading me more toward the pigs and the chickens than it did to any possible perpetrator. Anyway, it was just an absolutely farcical scene. And, just to be able to tell that story was, was nice. And then, discovering that our next door neighbors right next door had a pet saltwater crocodile, 8 foot long in their backyard. And, that it's just one of those things. No one will ever believe this. I've got to write this down. And it sort of began to take on, I guess, a shape from being maybe a storytelling forum for me just to share these quirky experiences into something maybe a little bit more deeper as I probably grew in confidence, after some positive feedback, I suppose, that, I started to explore some of my reflections and some of those weird feelings you get as an outsider here who's sort of trying to blend in, but is hopelessly incapable of doing so. And I remember presenting myself to the, to meet the Minister of Justice to try and resolve this issue we were having procedurally. And I was quite nervous about this thing. And I managed to, in the reception just outside her office, I managed to sort of kick over this glass and aluminium coffee table and completely destroy it. And I'm sort of there trying to piece together this coffee table when the Minister of Justice is calling for me. And just all these kind of very humbling kind of experiences where you just feel like a complete goose and you just think, what am I doing here? And then I suppose it evolved a little further then as a forum or a place I could explore some of the doubts and some of the struggles and how my personal faith would engage with that, and how I'd try and maintain some sort of vestige of sanity in this place when we were going through some fairly challenging times. And I suppose the writing kind of took shape from there, and I gradually grew in confidence, I suppose, and started to explore other things I could do with writing. And then obviously reading your book, Gordon, was a delight, and encouraged me further. And I was terribly excited to get a tweet from you. So it was it was nice.
Yeah, I mean, one of the things I think it's really beautiful about your writing, Jeremy, and is how you reflect upon how actually fortunate you are as a person, and how your children are sort of relatively fortunate, and you sort of compare that relative fortune with the kind of the fate of of many of the Timorese children that you've worked with that are living around you. And I think it's a really good reminder of just how kind of sort of blessed we are in so many ways, but also of how the kind of you put faces to names of the still urgent kind of health needs that there are in Timor-Leste. And sometimes with statistics can tell some story, but I think kind of some of the personal stories that you're telling are really, really important in the blog. So I wonder if you could talk a little bit about some of that.
Yeah, I mean, I guess for us that's a constant reminder. I mean, as you've said, this is a place that we love but don't necessarily always like, and there are things about Timor that are maddening and frustrating and difficult, and it's not hard to start to get worn down and to become a bit cynical, and but you only really have to just open your eyes to what's going on around you to realize that I mean, if you're not grateful for the things that you and your family enjoy, then you just haven't opened your eyes. And so it's I mean, the personal stories are just all around us. It's it's in a clinical setting, but just as much it's all it's having our the guy who looks after our house and comes and sweeps our garden for an hour a day. So, his wife having a very preventable stillbirth, under our, just because she happened to deliver when we went out of the country for a few weeks and someone took their eye of her, and a totally preventable death. And, you know, we really share in that grief with them, and this frustration of, you know, that really shouldn't have happened. We really saw that one coming, and, you know, it just shouldn't have happened. And I guess, you know, getting involved in people's stories, and it's, you know, I mean, I think it is quite powerful for our kids to hear these stories and to be part of that, and to realize how different their life is from, you know, from the other kids who are living just next door.
Yeah. Yeah, I mean, I've brought my kid. I've spent a bit of time recently in Bougainville, which is kind of vying to be to knock Timor-Leste off the perch as being the newest country in the 21st century. And it was really important for me to bring my children there. Both, they're 9 and 6 now, but to get a sense of just how different Papua New Guinea is compared to Australia, and sort of many ways a way of kind of counting our blessings and realize how fortunate we are. I wanted to ask you, I mean, I see some of the names that are on the tile as we're speaking, and I think we've all got our own stories of Timor-Leste. We've all got our own experiences of Timor-Leste. I have my own entry point. You've got your own entry point. Everyone has got their own entry point as well. And what's striking to me is, like, living in Australia is how much, when people's views on Timor-Leste seem to be based on 1999. There was this vision that it's kind of a place of kind of a hotbed of kind of violence and trouble, when it's really very, very, very much different. I mean, I took my family back I took Charles Murak and his little brother Patrick back to, and Suzanne, we went back to Dili in 2018, December 2018, seems like a lifetime ago. But there it really struck me that even in the kind of 5 years that I'd stopped living there, how different the place was. I mean, there was a aspirant middle class there. There was very much less of a sense of it being a Malay or a kind of international city. It reminded me very much as being a kind of very much an Asian city. It reminded me of a kind of sleepy version of small towns in Indonesia that I'd been in. I mean, you've been sort of there for 5 years, and obviously you feel a little bit like the frog in the water, because you don't know what, when you're immersed in it, you don't see it so much. But I mean, what for you has changed in Timor in the 5 years that you've been there? What's changed? What's stayed the same?
Yeah, that's right. I mean, as you say, I'm not going to be the best observer of this. I guess living in it, you know, because the change looks, you know, so gradual. But you know, I mean, there are the superficial things that obviously change. You know, there's more food on the shelves, and there's some street lights on the streets, and you know, and everybody's got smartphones. Not everybody, but you know, more and more. So you see those kind of cosmetic changes, I guess. But I think most of us feel that I guess, you know, not everything has changed, and some things are probably not changing fast enough. You know, there's I mean, the country's at an interesting place. We work a lot with the Ministry of Health and, you know, government counterparts, and there's this definite sense, this sort of coming of age moment for them, where they see that this is their time now, you know, to really take charge of their country and to lead their own way and to, you know, cast their own path. And that although they recognise the international help's been really important, and that they probably need some element of that going forward, and they can't quite break with it, I think there's a sense in which the people we're dealing with are now saying, you know, we don't want you to come and just help us. You know, we're ready to stand on our own feet, but by all means work with us. You know, yeah. And there are things that you bring to the table. You know, so that I mean, I think that side of it's gradually changing, but as I say, I think there are things that maybe aren't changing fast enough. You know, this is a country that, you know, as you all know, has just endured such, you know, trauma and sacrifice and cost, and carries, you know, very fresh scars of things that happened not very long ago. And yet in some ways, although that seems like it's all gone, there's no violence now, it's a very languid sort of tempo in Dili, there's no fear in the streets, but in some ways they still haven't quite woken up from the nightmare. It still carries on, because, you know, I mean, I've been to 2 funerals in the last 2 weeks, and you know, these funerals are huge and they're colourful and they're musical, and there's thousands of people involved in some instances, and yet these are thrown together usually in about 24 hours, because there's a preference, you know, as you may know, to try and have the funeral the next day. And you watch how efficiently they can throw a funeral together like this, but then you think, you know, why are they so good at this? And it's sadly because they've had so much damn practice. You know, this is a place where it's not at all unusual that this might be the third or fourth family funeral you've thrown this year. Everybody knows how to do it. And, and it's just, it shouldn't be normal that, your sibling dies before the age of 18, or that one of your children dies, or that your father dies in his 40s or whatever. That shouldn't be normal. And yet here in Timor, that still sort of is accepted as just being how it is. And so, I guess when we look at this place, we think that there's some real long time frames to be considered. This is a long road to walk. And, we don't really view Maluk Timor as something where we're going to just pop in for 3 years and run a project and everything will be fixed and we'll all fly out again. But rather is trying to work with the Ministry of Health to see if we can look at those, that foundational bedrock of how do we look at a 30-year time frame of starting to address some of those system issues and some of those issues around the health service delivery that will begin to make a dent on some of these things that really haven't changed.
Yeah, I mean, it's funny when you're speaking. I mean, there's these resonances that I hear between the experience that you're talking about in Timor, which I kind of, I remember your triggering memories of it, but also my time in Bougainville. Bougainvillians can organize funerals extremely quickly. Bougainvilleans can organize religious ceremonies really, really quickly. The challenge, I think, going forward for a place like Bougainville, and I think Timor-Leste is streets ahead of Bougainville in this respect, is how do you organize a state in that way? Because if there was the energy that was put into organizing kind of funerals and kind of weddings and kind of the traditional events was put into the functioning of both administrations, both places would be closer to Singapore than they probably are. I wanted to ask you a question. I mean, before I came online, I did what, and really is the question I think that is the question of the year, which is about COVID-19. I mean, before I came online, I checked my phone to see if Ireland, where my family is kind of waking up. And we always get messages just about the terrible situation that there is in Ireland. I mean, there's a set of lockdowns that people are following or not following. The death rates are kind of spiking up. It looks, it depresses me that I so much that my family and my mum and dad who went to Timor for my wedding have basically been locked in their house for the last 6 months, unable to leave. Timor, from looking outside, based on kind of reading some of the stuff on the Maluk website and reading various bits of social media, seems to have escaped COVID, seems to have conquered COVID, seems to have, I mean, it seems to be like this kind of island of normalcy in this world gone sour. So can you talk a little bit about kind of how well, or how, the Timor response to COVID and sort of what we can learn from that?
Yeah, well, I mean, I stopped COVID, Gordon, so it's been a tremendous personal success.
Okay. Oh, there you go.
I mean, actually, we've had very little to do with probably what has worked, because, I mean, as you say, Timor's done extremely well. But although we had the same terror in March and April, where everybody, I think experienced similar things there. And I don't think any of us in March or April thought we'd be looking at a situation in November where we've still got no community transmission and it's just contained at the border. And that's really just I guess, huge credit to the Timorese government that did take quite proactive steps back in March to shut borders. And I guess it's a place that didn't have a huge volume of international traffic anyhow, but closing the borders really early, setting up quarantine and decent testing with quite a lot of support from the Australian government and other partners. I mean, I think they did a tremendously good job. And actually, although Maluk did a lot and we're very proud of what we've done, in some ways what we've done is more being at the second line of defence, step back, which is what happens if COVID actually gets in and starts causing the sort of trouble we've seen in other places. How will the health systems stand up? And that's where we've been putting our energy. And of course, we haven't really been tested yet because it hasn't come in. And so, actually Maluk can't really claim any credit for the success so far. But I certainly hope that what we've done at the health centre level and with training health staff and so on, will hopefully have some sort of benefit in the future. It's more than just COVID, where we're trying to improve infection control and so on more broadly. But I mean,
yeah. I mean, that also sort of made, as you were speaking, I mean, it made me think of another kind of virus, which is the kind of HIV/AIDS virus, which is the virus that kind of haunted me whenever I was growing up. I mean, I can remember all the kind of the public information campaigns about that. And it's a virus that we don't really, it's receded from the headlines. It's a bit like Timor-Leste in some ways. It's way down the headlines, but yet some of the statistics are alarming. I mean, as I said, in Papua New Guinea, you have, and I think I'm remembering this correctly, that of the 26% of the women that are carrying HIV/AIDS in Papua New Guinea pass that on to their children. You've got a huge kind of tip, sort of underneath of the iceberg in Papua New Guinea with HIV/AIDS. We lived in Zimbabwe for a period of time. Again, they're another country that was kind of ravaged by HIV/AIDS, in which I think 40–50% of the population are on some form of antivirals. I was looking at your website before we began this conversation. I was looking at the work that you were doing on HIV/AIDS, and it made me think, I've never really thought about Timor-Leste in the same breath as HIV/AIDS. So is Timor-Leste as being as successful in this as it is with COVID, or is there a ticking iceberg, to mix a metaphor on that?
Yeah, there's definitely a ticking iceberg. Look, I think you're right. Timor's not a place that's typically known for having a big HIV problem. I've heard people say, well, Timor doesn't have an HIV problem. That may have been true at some time, but I think we're seeing the beginnings of something pretty alarming. And whilst I don't have the exact prevalence data, because it hasn't really been measured properly, I think we're getting some sense, just from our experience in our HIV program of what's going on. Far better that I get my colleague Madalena, who's the team leader of our HIV program, and I just happen to have sitting in.
Okay, so pass this.
I'll pass over and just ask. I mean, in your experience, with the team at the clinic, I mean, what would you say is happening in Timor with the HIV story?
Okay, thank you. So actually, we don't say that Timor-Leste is free from HIV, but we don't realize that there is HIV in Timor that increase every day by day. This increase the cases of HIV. So until now, that they most afraid of the COVID than the HIV. Actually, HIV also have a high rate increase every time in Timor. So yeah, I think this is a really big issue that we have to face and have to fight for, not only COVID or this.
And what's the profile here like with respect to the attitudes toward HIV or people's awareness of HIV or the stigma? I mean, how do you think those things are affecting what we're seeing here?
So in Timor, there's a lot of people that still make a stigma for the HIV, and it causes the people that they don't want to come to test, or they don't want to treatment, or they lost to follow up, they drop out because of the stigma that happen in Timor, because mostly of the population in Timor, the knowledge is still not really high. They don't really understand about the HIV. So the case of stigma that can cause death is the increase also.
Yeah, so I mean, I think the sense of the people we're working with here in HIV is that this is sort of a tinderbox ready to go up, and whilst it might never quite reach the the miserable heights of sub-Saharan Africa, I think most of the ingredients are there to see a really big takeoff in HIV, and certainly there's a lack of preparedness for that here for sure.
I mean, what are the steps here? I mean, is it a public health steps? Is it a kind of awareness? I mean, one of the things I remember from my trips to Timor over the last 4 or 5 years is these, and I say this as a former smoker, is how when I used to live in Dili, I used to think that it was brilliant because you could smoke anywhere, and B, they never had any of the graphic warnings that they had on Australian or British or Irish cigarette packets. The packets, the cigarette packets in Timor are among the most graphic in the world these days, which is the initiative of the former Prime Minister. I mean, they've got some very colorful explanations of what can happen, especially to men if you smoke too much. I mean, what is the best kind of way of addressing kind of issues of sort of HIV/AIDS prevention? Is it public information? Is it antiretrovirals? Is it what's likely to work?
So now we just doing the, for prevention, we just doing the public information, and also we started testing. For the testing, we started early testing for the pregnancy and also the most of the population. But the problem is they lack of information though, so there's not really a lot of people come to testing, and then that's why we started with training and then to build the knowledge for the people and also the healthcare worker to do the test. And also as treatment, we here we do give a free treatment for the PHAV if they come to treatment. But the problem also that they, because of stigma related, and then they like stop the treatment. And
yeah,
the we do is like treatment and testing and give information.
Yeah, thanks.
I also think it's worth mentioning from looking at, I did do my preparation for this by looking at your website, that my sense is that the work that you are doing on HIV/AIDS is kind of not fun. So, I mean, some of your funding comes from the Australian government and through other sources, but the work with HIV really relies upon the kind of monthly and one-off donations from donors like we're speaking to today.
Yeah, that's right. So, I mean, this HIV model, which, I mean, we're really, really proud of actually. So with this model, what we did is we started out 2 years ago, and we took Madalena and a few others, and they worked with Dr. Eleanor, who came over as a volunteer with Australian Volunteers Program, which was great to have because she was an infectious disease specialist, and she really dug in for 2 years and absolutely threw herself into this work. And we ran this model where we embedded this service within a Ministry of Health centre. So we're really working alongside Ministry of Health, made it about, it's their centre, it's their patients, we're using some of their staff, and our guys are working alongside them and trying to get this knowledge transfer of how to provide a really high quality model of care that's not just about clinical excellence, but also about addressing all the social factors and things around confidentiality and respect and social care and so on. And then over the space of 2 years, that centre's gone from literally 0 patients 2 years ago to now being almost 200, almost all new diagnoses. And that's been able to really carry on and be carried forward by our Timorese team, showing their leadership to work with Ministry of Health. But you're right on the funding. This one, we've basically had to fund it from Maluk Timor's general funds, which is private donations, right the way through. We've had a few little donations here and there to help us with some infrastructure work, but essentially the operations of this project have just been funded from our private donors, like the people on this call, I suppose, who and that's actually tremendously powerful for us, because you're not being bound up in a limited project that says you've got 2 years or you've got 3 years or whatever it is to run and deliver this project. We're able to actually really bed down some relationships and some trusts. We're able to I guess, invest the funds where we think it's going to be most effective in the things that we believe in, without having to jump through hoops to impress donors or grant requirements and so on. And it's enabled us, I guess, just to back this program in over the last 2 years. And now that's, really bearing fruit. And we hope in time someone might see the value in that and in what we're doing, and actually get behind it with some, solid long-term funding. But in the meantime, we'll continue to support it as best as we can. I mean, we run the whole thing for about $30,000 US a year or something, and it's on an absolute shoestring, and yet, delivers this extraordinary result. I mean, to give you an idea, often patients, when they present with HIV, they present very late, very sick already. I think more than 40% of our patients who are diagnosed with HIV already have advanced disease, and some of them are almost on death's door, actually, by the time we get to them. The immune system's broken down, they've got all the other infections. It's a bit like New York in the 1980s, and then with the care of the team, you're able to get people onto therapy, test and treat the people around them, restore them back to health. And although, as I say, almost half the people who present are in that condition, our mortality rate for the project is only 2 or 3% per year, which, if you talk in real terms over that 200 people, we're talking about maybe 80 people critically ill, 4 or 5 of whom have died, and the other 70 something have been restored to health. And that's an extraordinary record, but it also demonstrates to our Ministry of Health partners what's possible in a low resource setting, what you can do with the basic stuff that we've got at hand if you just provide a really dedicated and systematic model. So, you know, I mean, we think it's an exciting story, and it's great that we've got Madalena and the team doing so well.
Yeah, I mean, I think it's a great story, and I sort of take two lessons out of it, or maybe three. Let me see if we get to. So the first lesson is kind of how the importance of kind of donor funding that's not tied to aid grants, and you know, the importance of kind of the donors that we have here. And I'm proud to be a donor of Maluk Timor that are able to kind of, you know, pay forward on trust that you to do the work. But also the sense that you don't need a lot of money to do health work. I mean, there's often, I think, in development, we get fixated on these figures, you know, which is, this is a $6 million project, or this is an $8 million project. And you think, oh, well, the $8 million project must be better than the $6 million project. Because so it's this sort of game of, you know, like a kind of football score. How much a relatively modest donations go on to work. You don't need to have a big workshop. You don't need to have a big launch. You don't need to have you know, a set of kind of dancers that come to things in order to do this kind of work that you're doing. I've got a couple of other questions, Jeremy, but what I wanted to do was sort of open it up onto the chat function and see if we've got some really some of the other supporters that are on the call, to give them the opportunity to put in a question. If we don't have any questions, I'll ask you another couple of questions. You're not getting away just yet.
Okay, so Jeremy, from Barb, she says she's involved with a remote village, I think it's Laramie in Lord Tem, sorry about my my geography, and she's wondering, is information getting out to many of the remote villages?
Yeah, thanks for the question. So we've done some direct HIV training with some doctors who are working out in Lauthem, and actually have a number of patients out in that area. I don't know that word is getting out to the community exactly. What do you think the reach is like out to Lauthem? You know, which you know, for those of you who know, is the furthest east, relatively remote district of Timor-Leste.
So as Jeremy stated, we done the training in the district that we focus on the healthcare worker that work in the HIV area to take care of the patient. But we also try to like spread the information through the video to share in the whole population. But we know that some in the rural, they don't have like access to the TV or something. So we try to like not really. We still not really reach to all the rurals in Timor because there's some obstacle that we face, and then but we try, like we collaborate with Ministry of Health to spread the information through that, like pamphlet and others, but yeah, not really reach the rural area yet.
Yeah. I mean, it is interesting though that, I mean, the reach, I guess, is starting to spread. There was a story recently, some of you may have seen on the website, about a little, I think there was a 10-month-old girl who came from that sort of area, having been under the doctors there for quite some time. They hadn't worked out why this child, who seemed to have chronic pneumonia, wasn't getting better, wasn't gaining weight. Eventually, you know, transferred from there to the National Hospital, and then a pediatric doctor, you know, checked in on this child and thought, well, you know, maybe an HIV test could be the thing. And sure enough, it lit up positive, and then both parents lit up positive, and then they're able to get on the right treatment, get all those, you know, health issues sorted out, and then get to the point where, you know, not only is the family healthy, but they're also reducing, you know, their risk of further transmission to any other loved ones to, you know, close to zero. And the reason that was a success story for us is because the pediatric doctor who made that diagnosis had previously been through our HIV centre and learnt all about HIV, and had learnt about the importance of testing, and several months on just happens to be there in the right place to be able to make that diagnosis. And so, I mean, I guess we're kind of hoping to have this kind of outward ripple effect that, as you know, as we do more and more work, particularly outside of Dili, that you know, that we see a gradual improvement in the awareness of HIV and the need for testing, and also, you know, the way in which treating an HIV patient is not so different to any other patient. One of the doctors said recently, after 2 weeks of the rotation, they said, "Oh, these HIV patients, they're just like normal people. Aha! And anyway, a great penny dropping moment. So, we are, gradually having that sort of impact, and hopefully, one person at a time, starting to shift the attitudes.
So Jeremy, there's another question from Dan that leads on from that, and he's asked, how does our HIV program interface with the FMD graduates and trainees?
Yeah, so thanks, Dan. Dan knows our family medicine program very well, having previously been part of running it himself. So for those of you who don't know, we work with RACS, which is the Royal Australasian College of Surgeons, which is funded by Australian government to deliver family medicine training. And at the moment, we've got 24 trainees. And they all rotate through our HIV centre on this rotation of 2 weeks. And it was one of those that I was describing earlier, who then took that knowledge out and actually diagnosed this child and this family. And so I guess we feel like by rotating doctors through and giving them some exposure to what good quality HIV care looks like, we hopefully expand the reach, because some of those family medicine doctors are going to go on and become leaders in their own health centres and be scattered right across the country. So hopefully that's a way of expanding our reach. And I mean, I guess this is the kind of approach we take, not just to HIV, but I mean, for those of you like Gordon who have read the website, there's about 9 or 10 different programs, running. But I mean, all of them sort of try to imitate this in some way or other of working with the Ministry of Health, providing this model of what optimal care looks like in this context, in these circumstances, trying to pass on those skills to the Ministry of Health counterparts, trying to work out what are the real problems being encountered at the coalface, in that interaction with the patient, what are the problems and the barriers, helping them to solve those problems themselves. And then where there are systemic issues, we're able to feed those lessons back up to policy level and try and make some strategic difference at the top to ensure that, that the systems change to support better quality care. So we've got that going on in lots of different areas, HIV being just one of them.
Okay, so Gordon, did you have another question for Jeremy related around the HIV? Otherwise, I think Claire had a comment to make that
no, let's go to Claire's comment. I think these conversations are much better the more of us get involved. So over to Claire.
Okay, I might just, as Claire has had so much.
Okay, thanks, Michelle. Thanks, Gordon. I really loved your book. I've been involved with Timor for the last 10 years, involved with Maluk. I mean, just with HIV, I completely support everything Jeremy and Madalena have said, but just to add, it's all education, 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 like many other health dilemmas are, teaching the public about the wonderful outcome of HIV now and not to worry about the stigma, come forth for testing, et cetera, et cetera. It's about education. Educating the public, I think, will make the biggest difference. The question I wanted to ask you is, being an Irish person myself, I've been struck over the years in Timor about the similarities between Timorese attitudes and Irish, both countries that have been suppressed for so long. And that does affect health outcomes and education, I think, and communication. I just wanted to ask you about that. I think you made a comment in your book about it, that there are very many similarities between the two. I was just interested what you might say.
Yeah. Oh, no, well, this is when the questioner gets questions. So yeah, look, thank you. I mean, I think I said in the book, and it is true. I mean, I felt at home in Timor as soon as I arrived there. And why did I do that? Because it's Catholic, because it's got a sense of relationality where everyone's constantly figuring out who's related to who and what the relations are, but also the sense of kind of sort of family bonds, and the sense also that of the real importance of that. And I think in both countries there is certainly it's not at the forefront, but it's not residual either, a sense of having come through conflict, and how that actually shapes us as people, and it makes us sort of slightly distrustful, I think, in some ways, of people, of well-meaning outsiders that come in and
absolutely
and try to try to help. But then I also think it means that whenever well-meaning outsiders come in and stay for a long enough time, then we actually sort of accept them a lot and actually say, well, they actually know as much more about the country than we do. There was a wonderful British journalist called Robert Fisk who died about a couple of weeks ago. He was famous for his journalism on the Middle East, but he wrote most of his early work about Ireland and during the Troubles. And I mean, he was someone who really got the Irish really well. And so I do think there's resonances. And of course, there's a real powerful connection now between Timor-Leste and Ireland. I mean, I remember when I was sort of trying to learn Teton the first time, people would put in these words, and I thought, oh, you know, that sounds familiar. That sounds like a words of the little towns that I know where I'm from. You know, places like Dungannon and Omagh and Portadown, places that are, you know, on the map of most Timorese. Because just for Irish, I mean, we think of going to Australia in order to better our life. We think of going to America in order to better our life. And the many East Timorese are over there and really doing, you know, really, really hard work and really, really good work and doing exactly what the Irish have done, which is leaving their home in search of a better life. I'll tell you a funny story, but which is when you know the way everyone in Timor kind of talks about Malay, you know, as being kind of the sort of foreigners. And I was in Ireland last Christmas. It seems like a lifetime ago, but I was in a bus station and I saw these two Timorese, and I said, you know, Banabane Malay, you know, where are you going, Malay? And they were like, oh, you know, like, we're not Malay. And it's like, well, you're in our country, you're a Malay. So
very good.
It's but I mean, I'm from a little town called Downpatrick. It's a place of 10,000 people. There's East Timorese there. My mum, whenever she was able to go out, was able to bump into them in the supermarket and talk about her trip to Dili and her visit to Likisa. So I think there are real resonances between the countries, and you know, long may they continue. And I think, you know, what you're seeing with the kind of seasonal worker program, I think in Australia, is you're going to see a similar sense of kind of Australia as being a place, you know, to go to in time as well. I think it's one of the greatest kind of development projects that's going on in Timor and throughout the Pacific at the minute. So I hope that answers your question.
It does. It does. Thank you.
All right. So there's a question from Mark, who's asking Jeremy and Gordon about some of the complexities of writing in Timor and what advice they would give to aspiring young truth-seeking authors.
I'm going to let you. I mean, you're the published author, Gordon, so I'm going to handle that one to you. I think I'm just the amateur on the, you know.
Well, I mean, look, I mean, that the book that I wrote, available in all good bookshops, by the way, and on Booktopia, and please support the Family Fighting Fund. I mean, it made me. One of my favorite writers is Paul Theroux. And Paul Theroux's, you know, I read him as a child, and he said the job of a writer is to bear witness, you know, to actually say what you're thinking at the time. But he also says it's a pretty lonely job, because what you write is not necessarily what you think you're writing, is not what people are reading. And so the book that I wrote, you know, everyone's got an opinion on it. I mean, a lot of people really liked it. Some people really didn't like it because they thought that I was being too, you know, I don't know, sort of, I don't know what the word would be, too, I don't know, sort of too quick or something. I don't think quick is the right word. So I think, and I mean, I think the reason why I said, though, Mark, is why I enjoyed Jeremy's blog, is because there's a similar sense of kind of honesty to his cadences as well. And most writing about development is very not easy to read. Your eyes droop as you read it. It's all written in this kind of passive tense. Never anyone talks about the problems that they have. Everything's always an unalloyed success. And so, I mean, I don't regret writing the book. I'm writing another one on Bougainville at the minute. So, I mean, my advice would be to have a crack at it.
Thank you, Gordon. All right, so we're about 5 minutes out from the end of the allotted time for our webinar. So did anyone else have any questions? If not, Gordon, I might leave it to you and Jeremy to wrap up. I think there's one thing that we did want to ask everyone to do just briefly when Gordon and Jeremy and Madalena had finished up, is if people wanted to just turn on their cameras so we could just get a gallery shot of who's actually with us at the webinar. And then we'd also, of course, like to thank everybody for coming. But Gordon and Jeremy and Madalena, I'll leave it to you for the last few minutes.
Okay, great. Thanks. And this has gone really well. And I think it's gone really well in large part thanks to such active participation for everyone. So on behalf of Maluk Timor, I really want to thank you all. And I sort of, as I was looking around, I saw this is me 10 years ago. I was talking about my wedding day in Dili. This was the picture that was taken on my wedding day 10 years ago. And it was so hot at the time because it was, you know what Dili is like at sort of 5 o'clock in the evening. We were on top of this mountain. The sun was kind of beating into the church. And I remember like Suzanne and I were sitting at the altar kind of about to get married, and she looked at me and she sort of thought there was this sort of smell coming from me. I don't know whether it was the Holy Spirit trying to leave me, but it was my, it was the chemicals from my suit that was rising up. So I think it was about 40 degrees when we got married. So that's I'm going to get her and the two kids to come in and join the call as well. I just wanted to thank you, and Jeremy and Madalena. It's really hard to talk about yourself. It's really hard to sort of talk about your experiences in an open forum, and I want to thank you both for it. One of the things I was sort of reflecting on, and really Mark's question maybe made me think about it, is there's a big move within development at the minute, which is talking about decolonizing development, decolonizing aid, which is trying to say that, you know, the idea of kind of, you know, white Australians or white Irish people going to places like Timor is a kind of old hat model. It should be kind of wound up. It should be, it's off the past. And I read on LinkedIn a couple of days ago this very, very powerful account by some of the head of WaterAid, another organization that I have a lot of time for. He was talking about the depression that he was suffering because he was really trying to wrestle with that question, and he wrestled it with so much he ended up digging himself into the ground with it. So I wanted to sort of ask you, Jeremy, you know, I mean, where do you stand on kind of Maluk Timor and kind of its place, you know, within the aid thing? What are you transitioning to? Is it a 30-year transition? And where do you, you know, where do you stand with that debate? Because I think it's something that we all wrestle with at different times. Like when is it time?
Yeah, so look, I mean, we're definitely still wrestling because, I mean, it's a very live issue. And I suppose we look at what we do, and there are certain things we try not to do. Firstly, we try not to just come in as the experts and hand down technical advice and recommendations and then, you know, dust off our hands and hand over the report and let that be that. I think we've seen that fall fairly flat here. I think we've also tried to avoid being a little project team that goes and implements for a year or two and then again packs up, writes a nice report and gets out again, because again, that's another one that doesn't seem to work very well in the longer term. So I guess we've tried to strike for this model where we get in alongside and we build trust and we you know, convince everybody that we are there for the long haul and we're there to help them develop, not just for us to be able to take a nice photo and write a nice report at the end. But I mean, I'd have to confess, we at times, I personally have had some real doubts about this HIV program I've just been describing, because Dr. Eleanor, when she was so committed and so fantastic that she practiced at a standard that I didn't think was realistic. I thought we're never going to be able to hand this model over to Ministry of Health. We are shooting for a standard that no one's going to be able to imitate. I don't think this model is going to work. Eleanor's going to leave and this whole thing's going to fall over. Well, Eleanor did leave. She left about 4 months ago. And I think we've got our answer to that question as to, you know, would we survive when she left? Because currently, I mean, she still keeps in contact and is still very committed, but, and you know, still supports the team. But on a daily basis, the team are there now running their own shop and doing their own thing under the team over here. And I'll have to ask you how that's going. But, you know, from our point of view, I think it's a huge credit to Eleanor, and it's a huge credit to the Australian Volunteers Program as well that supported her. But it's a huge credit mostly to this fantastic team that have been developed and are now recognised as HIV trainers and are running fantastic high quality service.
Sorry, I'm getting bond my two.
You're just getting trolled. Oh yeah, I know how that is. So how is life after Dr. Eleanor? Is it going okay?
It is hard for us because she lived, and then because we have a lot of complication cases in our clinic or in Timor, and then but before she leaves, she already teach us many things that is like to build us, like when she leave we can like stand alone and run the clinic. But and then we're still happy because even she leave, she still have contact with us, everything we discuss together. She not like just leave and then that's it, but she still continue to like help us to do everything like around the clinic.
Yeah, no, it's a good answer. I mean, I remember going to a leaving do in Port Moresby. They call them go finish, where they sort of you go finish, and everybody was really happy at this leaving do of this expatriate that was leaving. I thought, oh, that's a bit strange because you didn't seem to like him when he was there. And they said, we're just really happy he's leaving.
Okay, so if I can just say to everybody, thank you so much for coming into the webinar this afternoon. I think it's been a really interesting discussion. Thank you very much, Gordon and Madalena and Jeremy. Thank you for taking the time and for sharing your experiences, and to everyone for the questions that they sent through and for taking the time to join us today. We really appreciate the support that all of our donors continue to give us, or our donors and supporters continue to give us. And from our family to everyone else's family, we wish everyone a wonderful Christmas. I know it's a little bit early, but we won't have an opportunity to say it face to face before Christmas. Wonderful, safe and happy Christmas. And thank you very much for attending today.